And thank you again for inviting me to speak this afternoon. I'm here sort of from the Naval Families Federation, but I'm speaking on behalf of colleagues from the Army and the RAF Families Federation as well. So I was keen when we spoke with Jane before to give a tri-service view on some of the issues that our families are facing. So if we could go to the next slide, please, Mandy. Thank you. So I thought I would, because I'm not sure who's in the audience today, so just to give an overview of the type of work that we do within the Families Federations. Just to clarify, we're not the sort of the welfare agencies within the single services, but we work closely with them and with the chain of command. And our role, as we see, is to take the temperature of the families' views and get out there and talk to our families, find out what the issues are that are affecting them on a day-to-day basis, and providing the advocacy support. So it's knowing as much as the Sussex Armed Forces Network team do, as knowing who's out there, what provisions out there, and how we can put families in touch with the right care, the right support and advice, so they're not being bounced around. Because that's often an issue that families say to us is, we're just given a list or links and we just need to know who to talk to. So we go out and speak with the survey communities. So just to clarify, for the Families Federations, we engage with families whilst their service person is still serving and during that transition phase back into civilian life. What that means, obviously, is if a veteran or a veteran's family contacted us, we would still engage with that family. We wouldn't turn anyone away, but we'd put them in touch with the right organisation that could provide the appropriate help and support to them. And we engage with families on a one-to-one basis, so they could come to us to raise a particular issue, and I'll come on to those in a moment. Or it could be, at an event we go to, now we're allowed out again, going to events like coffee mornings, for us, ships homecomings, families days, and just sort of finding out what the issues are, what the trends are, what families are dealing with, especially as we're coming out of this COVID-19 pandemic, hopefully coming out of, and how that's impacted upon them. Because what we then do is look at that information, look at their evidence and their lived experiences to work with the policy advice, the policy teams across, as we say there, the services, the MOD, government departments, to look at how those policy decisions that they're making impact upon our families. Do any of them cause any unintentional disadvantage, especially in line with the Armed Forces Covenant? And we say there we were described once as the critical friend. So within the naval service, we engage at all levels. My chief exec will go in and speak to first and second sea lord and tell them, the sort of the warts and all, what's going on, what families are talking about on the ground, and potential issues that are arising, so that they're aware as well. So if we can move to the next one, thank you, Mandy. So I just wanted to touch on this as to how we represent families. So we're out there talking to our families, engaging with them either face-to-face or online surveys, or they come to us with particular issues. And what do we do with the information that they share with us? Obviously, it is a confidential service we offer, so any information they share with us is anonymised. But we take it to all these types of people. And just to reflect on what Beth was saying, just to follow it on, is some of the ones that we've got there, the MOD Family Strategy Working Group. So we're working closely with those different work streams about how they're going to deliver the new revised family strategy, which has come out of a lot of it's coming out of the Living in Our Shoes recommendations from the SLU report. The three federations are also part of the longest title, the NHS England Armed Forces Public and Patient Voice Advisory Group, the PPV as we affectionately call it. So just to link, so Beth mentioned about the NHS Forward View that came out early this year. So the work that we do with our colleagues in the PPV fed into that Forward View. So it's that cycle all the time, is how we gather the evidence from our families, how we manage that, and who we feed it into to influence future policies. So some of the other areas that we look at, their local authority covenant partnership boards. So at every level, from the local level up to the national, ministerial meetings that our chief execs go to at Covenant Reference Group. So this is, working at the strategic level, constantly making sure that the needs of families and carers is considered at all times. So thank you. So wanted just to really to touch on some of the family issues. So thinking about what Beth has said about some of the challenges that carers face, I just thought I'd give you sort of some context of these are the kinds of issues that families report to us. So children's education, that could be anything from accessing school places when you're posted mid-term, or when you're coming back from overseas, or if your children's going through the boarding school system, it's issues with children's education, children's allowances, but also with if you have children with SEND and the impact that can have on how they access support and education within the education setting, but also not just in primary and secondary care, but going up into higher and further education as well, and issues, and looking at why children perhaps are not going into that tertiary education, and the reasons why, and working with organisations such as the Skip Alliance that I mentioned on the previous slide there. So again, that evidence has helped to build a service children's toolkit that can go out to schools, so that when they are engaged with children on a day-to-day basis, that they have that understanding. I think that's what our role is to give the person on the other side of the desk from our families that understanding, that back pocket knowledge of the lifestyle that our families are leading. One of the things that I often talk about from a naval perspective is the lifestyle that our submariner families deal with, and the communication challenges that those families face. So when their service person is away, there is no two-way communication. There is communication from the family going onto the boat, but nothing coming out. So if you think of, some of the things that Beth touched on, and they have a caring role, and for that period of time, that parent left behind takes on that whole lone parent and caring responsibility as well. So it's just to consider those sorts of options. Things like housing for those who've been within the armed forces community. No, this often comes up. So within the service, it could be the provision of service accommodation, how it's allocated, where it's located, does it meet the family's needs, do they fit within the policy guidelines, what information do they have to produce in order to qualify for adaptations perhaps. All this, especially if you're mobile as well. So the impact that it does, that you may have to go through this cycle every 2 or 3 years, and the impact that has on a family. I mentioned there about the non-UK and Commonwealth visa issues. This is an area that we're seeing increasing numbers of issues raised to us. Within the Army Families Federation, have had a fantastic team established for several years. Within the Naval Families Federation, one of my colleagues, Pete Hawley, qualified last year. Again, it is a very technical and specialised area, but looking not only at the issues that our service personnel and their families face with the visas that are coming into the country, but then potentially some of the issues that they then face once they're here and they're settled. And we look at those, and we're dealing with some health ones at the moment, and education and student finance and things like that. So partner employment, again, if you are part of a mobile family, or if you're part of a family whereby your service person is away for extended periods of time, or if they're weekending, that's a big issue, especially for the naval family community. What you might find is that you have naval families living in your area in their own homes, away from that identified support network that's provided by the services. But they've chosen that, but their service person is then weekending. So they may be away from the family home for 5 days out of 7. They may not get home every weekend, depending on where they're located. And the impact that has on the partner that's at home on their opportunities for employment. So the 3 Families Federations have worked with Defence Relationship Management and others, and we've developed the Forces Families Job website, which again is looking at how employers can identify and speak up and say, we recognise the challenges that our military community can face. We've signed up to the Armed Forces Covenant, and here is a range of opportunities that we want to offer to service families. And that could be employment, it could be training, internships, all sorts of options that are open. And again, it's just identifying that this can be an issue for our families. Obviously, in my area, as the job title says, in the health and wellbeing space, is looking at some of the issues that families face, especially with regards to the mobility. If you've got a family member that has complex medical needs and they are moving every 2 to 3 years, it is that challenge of how they transfer that care pathway when they move from one, it could be within England from one CCG to another, but it could be across borders, overseas and back again. So we're working, the 3 Families Federations are working with Anglia Ruskin University at the moment and we're just completing some research on the impact of mobility on healthcare, and that will be published early in the new year, and that will link in very much with Beth's work on carers, with the MOD family strategy, with the NHS forward view. So there's lots of big pieces of work going on at the moment of identifying the need and looking at how we can, we can continue to support and improve that support to families and carers in the future. I've touched on it there, the impact of mobility and the impact of deployments and long separations. For the Navy and some parts of the RAF at the moment, we've still got our folks away on the Carrier Strike Group deployment. They left in May, so their families have been having to deal with that period of separation. And these kind of deployments, especially for the Navy, a 7 to 9 month deployment is quite regular. So if you do have a caring responsibility, it's the impact that has on the family as well, not only on the person left behind to do the caring role, but also on the person who's deployed and the impact that has, and and their concerns about the family situation that they're leaving behind. And we also look at the issues around transition. And what we say is that it's not just the service person that leaves the armed forces, their family leaves as well. So we did some research about 3 years ago now, and we've published guidance for families to look at how they can make a positive and effective transition back into civilian life. That it's not just a focus on the service person. And I think, as the lady very eloquently said in that piece that Beth showed, it's sometimes the focus is on one person when actually it needs to be on the wider family. And just to clarify, when we talk about families, for us, it's, for the Three Families Federations, it's not just the serving spouse and partner and children. It could be the parents of. I know my colleagues in the NFF, and I know in the RAF as well. We go down to the passing out parades at Livingston and at Raleigh, HMS Raleigh. So we engage with families right from the day that they sort of effectively become part of our community. So letting parents know, giving that reassurance to say, this is the supports available to you as well. You're now part of our family, and this is what's out there for you. So if we can say, I think the support for carers as well kind of links in a lot with some of the issues, and I know some of the speakers that are coming after me are going to touch on their experiences and from a support charity perspective, how that is being taken forward. But as Beth said, I think touched on, it's that serving community and non-serving community, is that awareness of what's out there in terms of support. Things like the SAFA Forces Additional Needs and Disability Forum. They have a great website. They have a great guide for families and for professionals as well. They did a great piece of work called Families Fighting On, piece of research that again has fed into the MOD family strategy. We also have a network for serving carers. It's an MOD recognised network called Candid, which was started about 3 years ago. And it is again looking at how they can offer that peer-to-peer support within the services as well for those personnel who have that responsibility on a day-to-day basis. So if we can go to the next slide. I've done a very quick canter through. I'm very conscious of keeping to time. So these are the 3 magazines. So how we communicate with families and with service providers. We all have quarterly magazines that are free to subscribe to and delivered to you at home or to your office. We all have websites. We all have the social media pages. We all issue newsletters, monthly updates. We all run different projects of how we can support our families. So, we recognise there are some similarities and the issues that are raised for our service families, but there are some differences as well. So it's important for us to sort of gather that relevant evidence from our families, to understand where the need is, where there are any gaps in provision. So we all have, we have to have that local and national knowledge of what's out there. So when a family does contact us, we can say, right, this is the best person for you to speak to. And this is the way you can take it forward. Okay, next slide. What I've just done here is I've mentioned quite a few of these today. So I've just put this in a link. So when these slides are shared, all the links are embedded in there. Just to sort of focus on a couple of specific support for carers here. Royal Navy and Royal Marines Charity on their website, on the link there, they offer support. They are working in partnership to support unpaid carers. There is a digital platform that carers can access. So if you click on that link, if you want to know more about it, and the Royal Air Forces Association have a dementia care services as well, which is, I think, primarily targeted at those who are still serving, who are carers. So again, as Beth sort of touched on, there is that recognition that the role of carers, there needs to be more done. And I think in the charitable sector, work is underway, and I think we're all keen to work in partnership with other providers and with the single services to work to take that forward, to identify where our carers are, because I think that's often the issue, is that for whatever reason, carers sometimes don't speak up. They don't recognise that they are a carer. They just think that this is just something that they do. They're looking after their family member, so they don't realise of what they're entitled to with regards to, the carers assessments and that support and things like that. But also looking at how they can sort of take it forward and sort of support how that support's offered to them, how they identify themselves within their particular service as well. I think that's the key, is one of the pieces of the things that we've identified with families with complex health needs is they don't always want to speak up because they think it could have an impact on career. So I think that's a conversation that needs to be taken forward about from the services side and from the family side as well, about how that could be better supported in the future. So I'm conscious, I think I'm just to time there, Jane.